Hello, I'm Mo Martin. I had 6 weeks ago a rhinoplasty and an upper lip lift performed by Dr. Julian De Silva, and I had it under sedation rather than general anaesthetic, and I was so happy with the whole procedure and the results. The reason I really wanted to opt for sedation rather than general anaesthetic is because, apart from the risks, I knew that the recovery would be a lot better and a lot quicker, and also just feeling that it would be better for me generally. So when I went in, I had the medication, and it was a very relaxed atmosphere. Everyone was very kind and very laid back, and I felt very at ease. And I just remember laying down and literally going to sleep. And I was told that I might hear something, I might, be aware of things, and actually I wasn't at all. I wasn't aware of anything. I was very calm. And I just remember going down, and I remember waking up, and I was asked how I was feeling, and I was feeling really amazing, very relaxed, and it was a really easy process, and I would definitely recommend having sedation rather than general anaesthetic for a procedure like mine. So I had been thinking about having a rhinoplasty for a very long time. Since I was about 15, I'd not really been very comfortable with my nose. The side here, I had a little bump on the side, but it's something that was very important, and something I really need to think about for quite a long time, and actually researching my surgeon took quite a long time as well. And it took about a year before I found Dr. De Silva, which was through a particular website. And when I came for my consultation, I just felt very at ease immediately and knew that he was the right doctor for me for sure. It was something that I could have lived with, but knowing that I could have fixed it and it would have just enhanced my confidence was something that's quite important to me. And Dr. De Silva recommended that doing another couple of things would really improve the look of the nose as well as removing the bump, so I was really happy with that. I also decided to have an upper lip lift as well because I didn't like the fact that I had quite a long philtrum, and that made me feel like I was ageing a bit prematurely. So doing them both together seemed like a really good idea. And my confidence has just shot up since. I just feel a little bit younger, I feel fresher, and I also just feel so much more confident as well, especially when people are looking at my side profile. I don't feel too conscious and feel like I need to kind of turn my head to face people when I'm speaking, so it's done a lot of good for my confidence. Some very practical advice I would give to anyone thinking about having any kind of surgery, rhinoplasty or a lip lift, would definitely be to research your surgeon. And I think have a look around, make sure you ask the right questions. Don't be afraid to ask questions, don't be afraid to ask for qualifications, and look at paperwork, look at case studies. And also just the general feel with your surgeon. If you feel comfortable with them, then they're likely to be the right person for you. If you don't feel comfortable, if you've got any kind of doubt, then they're probably not going to be the right person. And make sure they give you the time that you want, so you should never feel rushed, you should never feel like they're trying to get you out of the office or sell you anything as well. It should all be done exactly for you, and you should have all the questions answered that you need. So that would be my best advice.